My name is Taya, and today I'm going to present my final research project on ambient clinical documentation as medical technology, business and clinical impacts on US healthcare. Ambient clinical documentation, a generative AI-based medical technology that records discussion between patients and doctors and generates clinical notes, is likely to bring about a radical change in US healthcare delivery. The present study analyzes the business and clinical impact of ACD in a systematic way and compares its pros and cons with standard documentation methods. The analysis incorporating insights from Robert Pearl and Geeta Nair on the innovation ambient clinical documentation. The paper presents ACD technology's placements within the medical technology domain, discusses its ethical and economic implications, market justice, social justice, supply, demand, moral hazard, and finally, by way of reasoned argument, asserts that ACD deserves to be implemented in the US healthcare system, but only under very strict rules of governance, equitable finding, and clinician participation so as to protect quality, privacy, and equity. Introduction. In the US healthcare system, documentation has persistently burdened clinicians, consuming a large portion of their time that might otherwise be devoted to direct patient care. This administrative overload contributes to clinician burnout, inefficiencies in workflow, and adds to the operational cost structure of healthcare organizations. As healthcare systems strive to improve quality while controlling costs, innovations in medical technology presents promising avenue from reform. Among these innovation is ambient clinical documentation, an AI-powered method that passively records clinical encounters and auto-generates structured notes for clinical review. To enrich the analysis with real-world perspective, this study draws on public writings and commentary from two influential US healthcare leaders based on available evidence. The paper evaluates strengths and challenges of ACD, compares it to traditional documentation approaches, analyzes its alignment with principles of market, justice, social justice, and economic theory, and takes a clear position on whether the how ACD should be adopted broadly across US healthcare. Overview of ambient clinical documentation. Ambient clinical documentation is a revolutionary AI application that integrates speech spectral recognition, NLP, and generative AI to transfer the doctor patient conversation into text and produce clinical notes drafts. The conventional way of recording a doctor's visit is obviously tedious, wherein doctors either write or dictates the notes to be later processed by the clerical staff. The AI powered system, however, works in the background. It listens to the conversation, does the transcription, picks out the relevant clinical, and sets it up to structure data elements such as history of present illness, review of system, and so forth. The practitioner can then review, make amendments if necessary, and endorse the notes that subsequently becomes part of the patient electronic healthcare records. Drivers of adoption. The ACD technology is becoming more and more appealing because of several structural pressures. Clinical workload and burnout sending their documentation to the computer takes a lot of time from the doctors and hence part of the cause of burnout. Workforce shortage. Providers are going to be less in number and thus the system should make the best use of the available clinicians by making them more efficient. Regulatory and billing demands. Very elaboratory documentation is being demanded for compliance, billing, quality reporting. Telehealth expansion, remote care make traditional documentation harder, and ACD may be the best way to document the telehealth situations. Technological readiness. AI has made huge leaps, and cloud infrastructure and EHR interoperability have made integration possible. The ACD is very much in line with the future of medical technology, which is delivering healthcare, improving efficiency, and cutting down on the administrative burden. This is the system framework analysis. The system framework allows for a well organized examination of healthcare effects at different levels, and inputs, process, and outcomes. System inputs, human resources. The application of ACD has a direct impact on clinicians' time management. It could lead to the elimination of burnout, enhancement of job satisfaction, increase in clinician hours for direct patient care, and notable change staffing needs. Technological resources, ACD implementation necessities the highest quality hardware, the most secure computing infrastructure, seamless integration with EHR systems, and state of the art AI model proficient in medical languages. Financial resources the cost structure consists of software licensing or subscription fees, hardware, and training EHR integration. As a result, the quality and availability of inputs would greatly influence feasibility and impact throughout the different settings, large health system versus small practices. System processes. ACD is a game changer for the documentation process in healthcare. The clinicians no longer have to type or dictate his or her notes during or after the consultation, but instead he or she is pretty much just talking to the patient while the AI quietly records. After the meeting, the clinician goes over the notes that are in the draft form, makes any change to that she considers necessary, and then gives his or her approval. This turnaround alters the clinician's workflow. System approaches and outcomes. The list of responsible profitable includes less time spent on visits, documentation, high productivity, a large number of patients are seen in the same period, better doctor and nurse feeling, uniform, happy patients due to doctors and nurses. On the other hand, possible risks and negative outcomes. On the other hand, technical glitches or slips leading to incorrect AI generated documentation, errors in understanding, wrong interpretation, and hallucination, issues of privacy and consent, initial cost burdens limiting adoption of the technology to smaller resource poor practices, the risk of over documentation and social justice problems. The adoption of technology might be limited to the already well resourced system, thus increasing the gap in care quality. Strengths and challenges of ACD, efficiency and time saving. AI transcription plus note generation can substantially cut down the time spent in documentation, reduced burnout and improved clinicians' well being, decreased administrative workload, standardization and consistency of AI generated notes are made from formal templates, telehealth and virtual care support, challenges and risk, financial barriers, privacy consent, quality and safety risk, workflow, equity, moral hazards. Comparison to previous documentation approaches, traditionally, clinicians manually type or dictate notes after patient encounters. This method gives complete clinical control and ensures that note reflects the provider's judgment. Human scribes and dictation system, how ACD compares. ACD offers an automated semantically rich, scalable solution that combines advantages of the and EHR integration. However, it introduces new risk technology. Economics and ethical analysis, market justice, social justice, and economic principles. Market justice perspective, the ACD technology is an example of market driven solution and fits very well with the market justice perspective, which advocates for innovation, competition, and efficiency. Justice perspective, if ACD model is looked through a social justice lens, which brings the concept of equitable access, fairness, and reducing by lessening the burden of clinical and augmenting the capacity of providers. Economic principles, supply and demand, moral hazard, market failure, and information asymmetry, economies of scale. Insights from healthcare care leaders on the transformative potential ACD. And why I support ACD adoption after concluding conducting the in-depth examination, I came to the realization that deployment of ACD in the US healthcare system should be adopted, but only if it is regulated by responsible governance. Rationally for this position, clinicians' health and workforce sustainability, administrative effectiveness, excellent patient experience, ACD will be sustainable. Conclusion, ACD is a technology that enforces the supply and requirement in US healthcare. It is medical technology with a lot of potential. On the other hand, ACD also imposes considerable difficulties such as high costs, privacy, and data security, concerns the possibility of errors and disparities between the well accomplished and extensive monitoring governance and fair provision of access. Looking at all this from all angles, I'm in favor of broad implementation of ACD, but only on the terms of clinician oversight, transparency, governance, and equal access. The use of ACD in a well planned manner will empower it to deliver on its promise as a revolutionary medical technology that not only gets rid of care gaps but also takes care of the provider support. Here are the references, and thank you.